Kawasaki's disease. Today I'm going to do Kawasaki's disease. What is KD? KD is a disease that is a rare illness that most commonly affects children ages 0 to 5, but can also affect children up to the age of 13. It is a type of vasculitis disease, and vasculitis means inflammation of your blood vessels. This can affect your whole body, including your blood vessels of the heart, your coronary arteries, and can also very rarely affect the lower part of your body. These are some side effects of signs and symptoms, of Kawasaki's. These are swollen lymph nodes, rashes, swollen or irritable tongue, redness of the eyes, and desquamation of the skin and the fingers. Common signs and symptoms of the Kawasaki's disease, also known as KD, are fevers. Most commonly is fever, 102 to 104, and that can last up to 5 days. A red rash, swollen lymph nodes, big bulge coming out of your neck, as seen in the picture right here. Red eyes, red and dry cracked lips, as shown in this picture. Red tongue with white spots, irritability, fast heart rate, diarrhea or vomiting, and skin peeling. Some of these signs and symptoms parents might not know, so they might think it might be the common flu or a virus, so it's very important to get your kid checked out. Causes and factors. The exact cause of Kawasaki's disease is not known at this time, but it is believed to be triggered by an infection, possibly viral or bacterial, in children who have a genetic predisposition. It is not contagious, so therefore it does not spread to other people, but some children are susceptible due to their environment or their genetic factors. How do you diagnose such a disease? Well, first they do lab tests. Blood and urine samples are probably the quickest lab test they can do. They have electrocardiographies, also known as ECGs, and this test records the electrical activity of the heart through small patches on the child's chest. The patches are connected to machines right here, shown in the picture, and it records your heart. So this kind of reminds me of when you're pregnant and you go in and they monitor the heartbeat. That's kind of what this is. The next one would be echocardiography, also known as echo. This test uses sound waves to create a picture of your heart. Also reminds me of when you're pregnant, when they do ultrasounds. Cardiac catheterization, right here. You'll see they'll put a catheter in your neck, coming down into your arteries, into your heart, and out through your pulmonary artery right here. Doesn't look very nice. Treatment of KD is, a lot of the times would be to start with aspirin or intravenous immunoglobulin, also known as IVIGs, and that is a blood product used to reduce your inflammation and prevent heart damage. So typically with the intravenous immunoglobulin, people that suffer or that are high prone to suffer heart attacks will take those. There are complications. Most children with Kawasaki's disease do get better within a few weeks, but serious complications do occur. Those involving may include weakening of your heart arteries, heart muscles stop working. Also, you can have a heart attack, inflammation of the heart muscle, myocarditis, lining of the heart, endocarditis, or covering of the heart, pericarditis. Very rarely, your heart will fail. And Kawasaki's may also affect other parts of your body system, and this includes the nervous, the immune, digestive, and the urinary. Prognoses are early diagnosis and medical intervention are always crucial to minimizing risks and ensuring a good outcome for affected children. So if you or your loved one or your child you see any of these symptoms, it's very important you check them out right away, take them to the emergency room, urgent care, etc. Thank you so much.